This video is about screening guidelines of different diseases and carcinomas. I will explain these guidelines in two videos. It will help you in your routine clinical rotations, but these are of particular importance in USMLE and PLAB exams, as nowadays there are a lot of questions about vaccinations and screening in these board exams. So by doing these videos, by doing these lectures, I am quite sure that you will be able to perform good in every sort of these scenarios, because these are of very key importance nowadays. So first of all, starting with the breast cancer. The test of choice for breast cancer screening is mammogram. The age limits are two. One is between 40 to 49 and the other is between 50 to 74. We do screening between 40 to 49 if the risk factor is present. And what are the risk factors? The risk factors are modifiable as well as non-modifiable. In modifiable risk factors, we have hormone release therapy, that is HRT, nulliparity, increased age at first live birth, and alcohol. In non-modifiable risk factors, we have genetic mutations or breast cancer in first degree relative. The white people are also one of the risk factors. They have these, the white, these are prone to develop breast cancer. And after that, we have increased age, early menarche, or later menopause. By later menopause, we mean excessive estrogen exposure without progesterone. So, as estrogen, these cause hyperplasia, and it's also one of the risk factors for breast cancer. So, these are the risk factors we talked about. We talked about the age limit between 40 to 49 because if any one of these risk factors is present, we'll commence the screening at age 40. But if none of these risk factors is present, then we will start screening at age 50 and will continue screening till 74 every 2 years. After breast cancer comes the lung cancer. The test of choice for screening of lung cancer is low dose CT scan of the chest. The age for starting is 50 years and the age limit is 50 to 80 years. The frequency is annually. What type of patients come in the screening category for lung cancer? These are anyone who is a current smoker with 20-year back history or someone who has quit smoking within the last 15 years. And when will we terminate the screening for lung cancer? We will quit the screening if the patient or if someone has quit smoking for more than 15 years, or if there is a person who has health problems that limit the life expectancy. So in these type of people, in these type of patients, we will terminate the screening for lung cancer. After lung cancer comes the cervical cancer. The screening guidelines for cervical cancer are a bit long and complicated, but I have categorized them in such a way that it will be easy for you to remember the tests, and as well as the age limits and the screening and the special cases which I have mentioned and which I will explain in the video. So the tests are two types of tests: pap smear and HPV testing. If the age is less than 21, no screening guidelines are recommended. And if the age is between 20 to 29, do the pap smear every 3 years. If the age is between 30 to 65, do pap smear plus HPV testing. But here is a special case which you should remember, that if age is between 30 to 65 and you do screening every 3 years, you will do cytology alone. But if you do screening every 5 years, then you will have to do cytology plus HPV testing. So these points should be remembered, as the exams, in the exams questions are asked in such a way they will give you the age limit, they will give you the frequency that you will repeat in 3 years or 5 years, and then you will be able to do, you will remember these things, that if in a question it has mentioned that the 3 years guidelines or screening frequency, then you will select cytology alone. Some other key points which you should remember, that in HIV patients, we do a pap smear at onset of sexual intercourse as well as at the time of diagnosis. Then we perform annually until we get 3 or greater than 3 normal results. After that, routine testing should be done just like other patients. Secondly, in immunocompromised patients, we do screening, we do a pap smear at a onset of sexual intercourse, and then we will continue annually with pap smear plus HPV testing. So these are some key points which you should remember, because sometimes they will mention a patient is immunocompromised or a patient is having HIV. So in such cases, you will remember these points and it will be easy for you to solve the questions. Now, some other points which you should remember is that if someone has a history of hysterectomy for benign reasons, we won't do any screening for cervical cancer. But if someone has hysterectomy done for the reason of cervical cancer, then we will continue doing pap smear until 20 years post surgery. For example, if someone has done hysterectomy for cervical cancer at the age of 45, then we will continue pap smear until age 65 because there is still a chance of recurrent cervical cancer. So we will continue doing screening for cervical cancer. We will stop screening at age 65 if the patient or if someone has no history of cervical cancer or there is no such severe pap smear results like high grade squamous intraepithelial lesion or cervical intraepithelial neoplasia grade 3. If no such results are present, we will stop screening at age 65. So after cervical cancer, I have put a slide for bladder cancer. Remember, no test, no screening guidelines are recommended for the screening of bladder cancer because of high rates of false positive results. I have mentioned this because of the reason that sometimes for to confuse you to check that you have studied about it or not, they will mention about screening about bladder cancer, but you should remember that there are no such screening guidelines for bladder carcinoma. Same is the case for prostate cancer. No screening guidelines are up till now recommended for prostate cancer because these are controversial topics and some no research, no mm, research study has still proven that way whether it's effective or not. So we won't do any screening for prostate cancer. But one point which you should remember that age is the biggest risk factor for prostate cancer. It has come in multiple questions and will be you will also get an idea about it in your routine clinical rotations and there are multiple exam points about it. So you should remember this that the age is the biggest risk factor for prostate cancer. After that comes the colorectal carcinoma. There are multiple tests performed for colorectal carcinoma, which includes fecal occult blood test or fecal immune test, CT colonography, sigmoidoscopy plus annual fecal immune test or colonoscopy. But the screening, the frequency for every test is different. So for fecal, so if we do fecal occult blood test or fecal immune test, that the frequency for screening will be yearly. If we do stool fecal immune test DNA, then the frequency will be 1 to 3 years. If we do CT colonography, then the frequency will be 5 years. If we do sigmoidoscopy, then the frequency will also be 5 years. If we do sigmoidoscopy plus annual fecal immune test, then the frequency will be 10 years. And if we do just colonoscopy, then the frequency will also be 10 years. So what will be the starting age? What will be the age limit? The starting age for colorectal carcinoma screening is age 45, and the time limit is 45 to 75 years. But if there is family history of colorectal carcinoma in first degree relative, then the starting age will be age 40 or 10 years before the diagnosis of first degree relative, whichever comes earlier. So you should remember these are very, very important points for exam purposes. So after that, we continue the colorectal carcinoma with some special cases. For example, familial adenomatous polyposis. If this case is present, the test of choice will be colonoscopy, but the starting age will be aged 10 to 12 years and the frequency will be annually. If the patient has Lynch syndrome, then the test of choice will be colonoscopy and the starting age will be age 20 to 25 years. The frequency will be every 1 to 2 years. If the patient has a history of inflammatory bowel disease, then the test of choice because inflammatory bowel disease is one of the risk factors for colorectal carcinoma, test of choice will be colonoscopy. And when will we start? We will start 8 years post diagnosis of inflammatory bowel disease. The frequency will be 1 to 2 years. If family history present, for example, first if anyone having first degree relative at the age less than 60, the test of choice will be colonoscopy. The test of choice for all of these special cases is colonoscopy because it is very reliable type of screening test, and the age will be age 40 or 10 years prior to diagnosis. The frequency will be 3 to 5 years. Some special points which you should remember for exam purposes is genetic testing for Lynch syndrome is very important. If, for example, if you are suspecting Lynch syndrome, then you do the genetic testing. Secondly, most common extracolonic malignancy associated with Lynch syndrome is endometrial cancer. For example, if you are suspecting colonic malignancy, and if someone has also endometrial carcinoma, so it raises a suspicion for Lynch syndrome. After that, if hysterectomy, we'll do here the hysterectomy is recommended in some special cases. For example, hysterectomy with bilateral salpingio oophorectomy at the end of childbearing age is recommended for women with Lynch syndrome because Lynch syndrome has also association with endometrial carcinoma. So it is of key importance that if the patient has end of childbearing age, if the patient wants no further children, then hysterectomy is recommended in such patients. So this is the end of our lecture, and I recommend you to watch the other video because I will also explain some other cancers, some other carcinomas, as well as some other diseases, some health conditions which needs to be screened. And because there are multiple scenarios, so I wasn't able to do them all in one video. So the second video will be posted, and you will be able to learn from that, and it will help you in your exam purposes because these are very important points, and try to remember all of them. Thank you.